The expanded program on immunization in Ghana began informally around 1974 and formally in a structured manner, I think in line with the Alma-Ata Declaration on Primary Health Care around 1978. And from that time, we provided for vaccination against 6 disease entities: the oral polio, then the vaccine was given, then the DPT, diphtheria, pertussis, tetanus, measles, and then BCG. So that continued till 1992, when we introduced yellow fever as part, and it continued till in 2002. We've added 2 more antigens. So we now provide for 9 disease entities. We measure to make sure that the diseases we are vaccinating against are reducing in incidence. And we've measured this. We've seen that some diseases are on the decline. And we've made quite progress, a lot of progress in polio as a disease, and also in measles, where for the past 8 years, we've not had any death from measles in Ghana. And as for diphtheria, throughout my practice as a doctor from 83, I've never seen. So we've made, and whooping cough too has gone down. So we made quite a lot of progress as far as immunization is concerned. And we have we are more or less trying to even bring in more and more, because the Millennium Development Goals need to be reached, reducing under 5 mortality. And we see the potential of vaccination in helping to reduce under 5 mortality, especially the 2 new vaccines we are targeting are against pneumococcal disease and then the rotavirus disease. So we submitted and we are in the planning stage. And it's our hope that by 2012, we can introduce either 1 or 2, depending on availability of resources. And we've made quite a considerable progress in coverage, beginning around the 70s and 80s, in the 80s and 90s, with coverages of around 70-80%. But now, almost all the antigens were around 89, between 85 to 90%, which is quite good. And the disease incidence has gone down. But immunization, you need to continue in order to sustain gains. And any reduction in incidence can make the disease bounce back. And that is what we need to prevent so that we continue. We are on course and can serve as a good example for our neighbors, and then together as a global effort. Of course, we need to play our part so that total eradication of disease like measles can be achieved, and reduction in disease incidence can be maintained, and in mortality can also be maintained. Immunization is one of the most cost-effective interventions, and the visibility in saving life is tremendous, and we need to put in money for that.